I am here with Dr. Williams, and today we're playing Eye Care Fact or Fiction.
Wearing glasses weakens your eyesight.
Fiction. Wearing the eyeglasses are going to actually make you see clear. And some patients actually have they're used to having blur. So when they put the glasses on, they see clearly. And then when they take off their glasses, they see that blur again. Sometimes they think that their eyes got worse after wearing those glasses, when in reality, nothing happened. They just see clear with the glasses.
Rubbing your eyes can cause damage to your vision.
Fact. Rubbing your eyes can lead to a condition called keratoconus, which can cause thinning of the cornea. It can lead to abnormally high amounts of astigmatism, and it can become so thin that it may require corneal transplantation.
People with light-colored eyes are more sensitive.
Fact. A couple different things with light-colored eyes is the amount of pigment you have in your eye. Even the back of your eye has pigment, and when light comes in there, a lighter color iris, they tend to be a little bit more light sensitive.
Eating carrots improves your vision.
Fact. Vitamin A is found in carrots, and vitamin A is very important in the retina and how it transmits light from a light ray to information to the brain to see. It's also good for the surface of the eye and maintaining a healthy tear film, and it can help prevent dry eye. So lack of vitamin A would cause superficial issues as well.
But to be clear, you can have a bushel of carrots, and if you are highly nearsighted, you're still going to wear glasses.
You don't need an eye exam if you have perfect vision.
That is fiction. We know there are several types of eye diseases and conditions that can occur even if you have no change to your vision.
Yeah, glaucoma being one of them, it can silently steal your vision. You have no clue what's happening. So unless you had an eye exam, you have no idea what your pressure is and if you're having damage.
Sunglasses are only necessary on sunny days.
Fiction. Even if it's not sunny, there's still UV light coming down. Again, when it's snowing, the UV light coming down, it's bouncing off the snow. There's a lot of UV exposure that can happen even on non-sunny days. So wear your sunglasses.
Blue light glasses prevent all digital eye strain.
Fiction. A lot of the studies regarding the blue light lenses trying to help with eye health and eye strain were not necessarily done on human eyes, and we've come to find that blue light filters may not be actually protecting the retina as much as they once were described to be.
Children can outgrow their need for glasses.
Fact. A lot of kids start off more farsighted, and as the eye changes, a lot of times that farsightedness can be reduced. It's not all the time. If they end up, more nearsighted in the early ages of life, they probably are going to be nearsighted, but yeah, the prescription can change when you're a kid.
It's okay to use over-the-counter redness-relieving eye drops regularly.
Fiction. A lot of the over-the-counter redness relief drops contain a ingredient that shrinks the blood vessels that bring blood into the eyes, and chronic use of those drops can alter the musculature of those blood vessels. And then if a patient stops using them, we see that they can have what we call rebound redness, where those blood vessels become very engorged and the redness may be worse than it initially was.
Yeah, a lot of times there's other problems going on, and Visine is like one of the first picks you do, and they just do it instead of figuring out what the true source of the problem is. They're going to Visine to try to fix everything.
Using expired eye drops can lead to infections.
Fact. At the end of the day, it's a liquid, and there's a preservative in it, and much like anything, it can actually have other issues, like bacteria can infiltrate it, or fungus, and now you're dosing your eye with that, and you're putting all these contaminants in your eye. So yeah, avoid the expired eye drop.
Your eyes get sunburned.
Fact. The eyes can get sunburned.
But not sunburn like you think. You're not going to go out and get your white eye turned into like a brown color. Wind and UV exposure can cause cells on the surface of the eye to create more cells called guacula, and you get a tissue typically in the 3-9 o'clock position. So in a weird way, that can kind of say it's a sunburn effect, but it's not going to get tan. Thanks for joining us, and we'll see you next time.